So how exactly does mewing or your tongue posture affect the way your face looks? My name is Ryan from Best Face Forward, and in today's video we're going to be talking about the exact facial features that are affected by mewing and tongue posture. What this video is also going to do is it's going to enable you to realize the features that you could possibly improve by using mewing and be able to identify if you could benefit from mewing yourself. The first three features I'm going to talk about fall under the same umbrella, which is convex face shape. Basically a face that has a convex shape like this. The first of those things is going to be a recessed chin, or your chin slanting backwards. So the reason that this happens is because when your tongue is not on the roof of your mouth, your jaw drops down. When this happens, your jaw also drops backwards. You can imagine there's more space between your tongue and your upper palate. Now that your jaw has fallen down and back, your chin is going to be behind your mid-face. This also leads to number two, which is going to be a longer face. If you have more space between your tongue and your upper palate, your overall face shape is going to be longer. So now your lower jaw has become longer, as well as your chin appearing to slant back behind your mid-face. The third thing that we're talking about is a slanted forehead. Why on earth would mewing affect your forehead? What I can tell you is that it's usually because of forward head posture. If you follow my channel, you know that poor tongue posture often leads to poor body posture, or the other way around. So picture it like this. You have forward head posture. What that means is that your head is coming forward. When that happens, your head is coming down. So what do you have to do if you're walking around? You have to tilt your head up so you can look around. Usually people who have forward head posture, their face looks even. But what you notice is that their forehead slanted back. Why? Because their head is literally rotated back. The next three things we're going to talk about have to do with the shape of your lips and your mouth. So the first one of the three is a large lower lip. Now, I'm sure that you guys have seen it. You've seen people walking around that have a lower lip that kind of hangs over. This is something that I always had. And this is actually a common thing in people with mewing. What you might think is that, oh, it's just genetic, that their upper lip and their lower lip is just bigger. In actuality, what's really happening is that the low lip is hanging for a particular reason, which I'm going to tell you now. Because number 5 is your Mentallis muscle. What's the Mentallis muscle? It's this little bumpy thing on your chin here. This muscle here. The reason that this Mentallis muscle gets overworked is because our faces are long. When the face is longer than it should be, now the lips have to almost work extra hard in order to close. So another muscle is used, which is the Mentallis muscle. Now what this muscle does is it pushes your lip upward. This is your orbicularis oris muscles, which are the muscles of your lips. They're circular. They are supposed to close your lips, and those muscles alone are supposed to close your lip. Once this muscle here, your Mentallis, has to get involved, what happens is it pushes your lower lip directly up. So it looks like this. Rather than just these muscles working, now this muscle has jumped in when it's not supposed to. And that is what leads to the lower lip looking like it's hanging down, and this chin muscle look like it's trying so hard to close the lips. People who have very good tongue posture, their lips look like they're even. Their lower lip and their upper lip look like they're virtually the same size. Now for feature number 6. This is going to be the Gummy Smile. Now, the Gummy Smile is something that I have had almost my entire life, and I'm going to explain to you how the tongue makes you have a gummy smile. So when your entire tongue is engaged on your palate, essentially it makes your palate wider. And when you smile, your lips are going to be stretched out to the side more. Now, when you don't have that force of your tongue up on your palate, when you smile, your upper lip gets stretched upwards. When this happens and you smile, now your upper lip is more thin, so more of your gum is just revealed. As you improve your tongue posture, you're going to notice that your smile goes from being long and more narrow to wider and less gum showing. The last three features are going to be affected by the position of your maxilla. Now, for those who don't know, the maxilla is the bone that is resting above your upper palate. So that's the main thing that affects your face shape when your tongue is not in the proper position. Now we're going to go into number one, which is the apparent size of your nose. Now, please note that it's not really about your actual nose size changing. What it's about is that because this maxilla has dropped backwards and down, it appears like your midface is more sunken in relative to your nose. So although it won't affect the actual size of your nose may look bigger because of that contrast. The same actually applies with your eyes. Now, your eyes are going to look like they're almost sunken in if you have poor tongue posture. This is something else that you can notice. So when your tongue is not pushing up against that maxilla and it falls down, now it's going to look like your eyes are sunken in. You can almost look tired sometimes. So now the last thing that's going to happen is that your arch is essentially going to collapse. So the arch of your palate, instead of being nice and wide, as we know, comes high and narrow. This is called a malocclusion in dentistry and orthodontics. What this means is that you might have crooked teeth. If you notice, a lot of people who have very good facial structures may have never had braces. And if you see people with the long, narrow face, most of the time they have had braces, and this is because as the palate narrows, the teeth get crooked because they have nowhere to go. Time for a bonus number 10. The last thing that's affected, which actually is very important, is going to be your jaw muscles or your masseter muscles, and here's why. When your tongue is pushing up hard, your jaw muscles oppose that force of your tongue. This is called an antagonist muscle. Antagonist is kind of like the bad guy in literature, but antagonist muscle essentially means when one works, the other works harder. So the harder your tongue is pushing up, the harder your jaw muscles bite down naturally. They exert more natural force. This means that people with good tongue posture just naturally have those full-looking masseter muscles that people with the long slanted faces don't. So it may just look like your face is underdeveloped. Another contributing thing that Mike Mew talks a lot about that I've learned from him is that when we're chewing soft foods like we do nowadays, our masseter muscles don't get as much work. So historically, our ancestors thousands of years ago ate a much tougher diet. And there's a lot of research and studies that show that their muscles and their arches were more well developed because of this. Thank you guys for watching this video. If you liked it, please subscribe. The next video I'm going to be posting is going to be about exercises and stretches for your posture and your tongue so you can begin to learn how to improve these issues. I'm going to be doing more videos with Dr. Estrabilo to further explain how you can come to a solution to this problem because it can be done. So thanks for watching, and I'll see you in the next video.